All right, well, welcome everybody to the Aurora Health Alliance Social Determinants of Health Interest Group meeting today. My name is Julia Mecklenburg. I am one of the co-chairs of this group, and I'm excited to introduce our new co-chair, Tessa Carlson. And I will let Tessa just share a little bit about herself and what she is expecting to bring to our awesome group. Tessa, do you want to introduce yourself?
Thank you, Julia. So I'm Tessa Carlson. My pronouns are she, her, and hers. I work on the Anschutz campus in the somewhat newly formed Office of Diversity, Equity, Inclusion, and Community Engagement. I was with the Community Campus Partnership formerly, so some of you might be familiar with that program. In this new office, I'm still going to coordinate career exploration activities for Aurora Public Schools students. So just really trying to, promote those opportunities. And then a mix of other things. So, I hope to just continue building relationships in the community. And I have a lot of connections with the Anschutz campus. So I hope that I can bring some interesting information from that side of things for this group as well. So thank you for having me.
So I thank you all for joining and sharing, and I am excited to pass it off to Rene for his presentation.
Cool. Thank you. Thank you, Bobby Joe, for driving. So if you can roll your R's, it's Rene Gonzalez. If you cannot, that's fine as well. Rene works. I've been with Colorado Access for about a little over 5 years, and I actually started in the northeast part of the state, in Greeley, Colorado. I'm sure some of you have heard of it. It's a wonderful community, but that's where Colorado Access used to have an actual contract. And when the contract wasn't renewed, I had an opportunity to come to the metro area. So been in this area for a little over 2.5 years. I'm still learning a lot of the great folks that are part of this community. And I've spoken to many of those who are attending today's presentations. So it's good to see some faces. Just a quick background on who I am and why health equity is so important. So I came from Mexico, and I went to Greeley. The reason why we migrated and immigrated to Greeley is because during the Bracero program, where the U.S. had a partnership with Mexico to bring workers over to work in the fields, my dad was actually part of the Bracero program. And so he would come out and work, and then eventually he brought everyone else. And so that's why we grew up in a very predominantly agricultural based community in Greeley. And so that was just a brief background on who I am. I went to school at UNC. I got my MBA at Regis University, and then I went back to CSU to get my PhD, where I've studied critical race theory. Was one of my research areas, which has a lot to do with equity and diversity and inclusion. So one of, if not the external lead of our health equity task force, because of my background and my experience in this space. I think I lost my slide deck, so I can start.
Sorry about that. Someone said that it wasn't full screen, so I'm trying to figure out how to. Apologies.
I can talk more about myself if you like. That's fine. I'm just kidding.
Sure.
No. It's been great coming into a very progressive community like Denver and the metro area and Aurora. I moved to Aurora when I first came over from Greeley, and I've had an opportunity to interact with a lot of individuals in this space. So, we got it back. Okay, next slide, please. So about 6 months ago, there's a very interesting proverb that I've been using lately, and it talks about the best time to plant a tree is 20 years ago. The second best time to plant a tree is today. And I think it's super applicable for diversity, equity, inclusion. We should have been doing this a long time ago. but we're doing it now. This is the second best time, right? And there's a lot of energy in this space to make some changes, some significant changes, right? And so Colorado Access is also trying to move in the right direction with diversity, equity, and inclusion. And so we had a brave soul, her name is Charlotte Hill, within Colorado Access, that actually approached our CEO after the murder of George Floyd to see what we can do and what kind of changes we can make. And so because of that, we talked about having this health equity committee at Colorado Access. And it's an external facing health equity task force that we created. And as you can see, we have close to 20 to 25 organizations. Even within this list of organizations, there's multiple people attending. So we have close to 30 people with this exploratory task force. And this task force isn't all inclusive by no means. It's an ongoing task force. It's a finite task force. We actually disbanded it, and I'll give the reasons why, because it is a task force, and why we asked them to be part of this particular initiative for Colorado Access. But Shawnette, who's on the call, I have to give her credit. She did a lot of recruitment with our community-based organizations. And as I go through this presentation, and as you see the current screen in front of you, I always welcome other suggestions in terms of community organizations that we would like to invite to this conversation with Colorado Access in 2021 and moving forward. So keep that in mind. And as I go through these themes that have come up from this exploratory task force, think about the organizations that can help support these various themes. But this is a group that we convened over the past 5 months. And it's been a really good opportunity to share some thoughts and ideas in this space with this exploratory task force. Next slide, please. Thank you. So over the past 5 months, we had a series of 5 meetings. And the first of the 5 was really a listening session with our task force. And it was about understanding the health disparities and health inequities that are existing in our communities, primarily our communities of color, right? And so we wanted to take as much information in as possible and just start uploading what our community-based organizations have been experiencing, what our members have been experiencing in terms of health inequities in our communities. We didn't say much, which is great. We just listened at this first meeting. The second meeting in November is we talked about this idea with shared measurement and how that impacts our performance measures with other health inequities and health disparities that are existing in our communities, right? We have to make sure that whatever we do with this health equity initiative at Colorado Access is something that we can really leverage and support. We talked about things that came from the conversation around pipeline to impacting people of color in healthcare, and how can we get people of color in the healthcare field. You know, that's not something that we do at Colorado Access, but it's something that we can partner and support. So we have to make sure that we're aligning efforts with our community, that we're doing it in a strategic way. The other piece that we talked about is this idea about health equity from a data perspective. There's a huge gap in health equity data, right? And so we don't know, you know, that's something that we asked our partners. We invited a group of health equity data folks from Tri-County, from Denver Department of Public Health and Environment, from Denver Public Health. We actually also invited some internal data folks within Colorado Access to speak to this health equity data perspective and what gaps exist. I think it's something that's being seriously considered with some of our partners at Tri-County. Healthcare Policy and Finance, they're actually devoting $4 to $6 million to create some kind of data dashboard. CDPHE, Colorado Department of Public Health and Environment, they're also putting some money and resources into this health equity data piece. So that's something that we're going to pay close attention to. Again, going back to what we do versus what we can and can't do, I think partnering with our system partners in this health data piece is really going to be an important part of our work. We have limited bandwidth in this space, but we're looking for partners to work with for this data health perspective. So in November, we also looked at these themes, which I'll share in a second, and started unpacking these themes a little bit more and how to move forward with this shared measurement philosophy and how that can help Colorado Access in terms of building a health equity agenda for 2021 and beyond. December, we continued to work with these themes. We continued to unpack them more, and we started to take some action steps on these themes in terms of really figuring out what we can do in terms of concrete work. And a lot of it is about partnering with other departments internally at Colorado Access. We hate to overpromise a particular area or theme if we don't have support internally to do a particular area of work. So that's one of the things that we have to take back as we build out a health equity agenda or initiative. And then we also talked about what this health equity structure is going to look like for Colorado Access moving forward. We established a task force, but the main role between a task force is to do something finite and then disband, right? And so we want to continue this work with our task force members, and some have continued to show interest to build out something. We don't know if we want it to be a committee per se, but we have some really out-of-the-box innovative ideas to approach this into 2021. I'll share that with you in a second. And that was really the final meeting in December, is to finalize a proposal. We actually didn't get to a full-fledged, baked-out health equity initiative, which is completely fine. This is the first step into building a health equity strategic plan. We did manage to disband the group, obviously, but we're looking to revamp it into a unique structure moving into 2021. Next slide, please. So I've been talking about emergent themes in the previous slide and what that looks like. And so these are some overarching themes or focus areas that came out of our work with our community external task force. I'll start from my left and go right. Because of COVID, and we saw what type of impact that made for our communities of color and how they were disproportionately impacted because of COVID. So one of the major themes were crisis planning and response. What does that look like for vaccination? What does that strategy look like for reaching out to our communities of color and dispelling myths around vaccines? I was fortunate enough to get my parents vaccinated in Greeley, Colorado this past weekend, and they were hesitant to do so. I had to hold their hand pretty much to get them to get vaccinated. And so it's something that they're hesitant to. And again, putting that health equity lens, putting that approach to why so many communities of color are hesitant to get the vaccine. We also have to consider that. I don't need to speak to this group about social determinants of health. This is what you do and why it's important. And it's great to see that our external task force align with what you all are doing with this SDOH group. So I'll show a different visual in the next slide on how this connects to everything else. But the next one is DEI healthcare institutions. This theme was something that I mentioned earlier, is this pipeline to support larger healthcare institutions in terms of promoting people of color in this field, right? What does that look like? Colorado Access isn't particularly does work in this field, but there's ways that we can support this initiative. We have a community innovation pool program, which supports innovative ideas and programs to fund social determinants of health work, innovative work with a health equity lens. So, there can be some opportunities that we can support other partners that want to do this particular type of work through perhaps funding and different types of support. Community is a huge part of this work. It's why we built out this external health equity task force with community partners. That's going to be a continuing and ongoing commitment from Colorado Access. Access to care. I don't need, again, some of these things, like I'm preaching to the choir, right? You guys know about these issues. And so it's good to see you all here and understanding that these are the things that we're dealing with on a daily basis. So how do we impact access to care with our members as well? I mentioned data equity and what that looks like in the previous slide. So we're trying to figure out who to partner with in this space, and more importantly, what data are we going to look for, right? Exactly. There's a lot of things that we can focus on, whether it be diabetes, whether it be COVID vaccination rates, whatever we decide as a group, as a task force, then we have to look at the equity, and then, then we have to look at the data, right? So that's something that we need to build out internally to identify what specific areas that we need to focus on, then look at the data with that specific area. DEI, medical and health interventions, and the last one, communication and health literacy. Those go hand in hand in terms of, say we do want to do some programming efforts with outreach or evidence-based programming in a particular community or region-wide specific health intervention. We want to make sure that there's a DEI lens when we do it at Colorado Access, right? We want to make sure that the communication and health literacy promotion piece, the content, everything that's done with the DEI lens and any type of intervention that we do with our communities. And so that's something that, we do internally from a marketing perspective and from a health programming perspective. But then we also want to make sure that we're leveraging our communities that work with our members on an ongoing basis and making sure that we're doing this appropriately, that we're not missing anything, that we're trying to get the exact feedback that we're receiving from our community partners, and that we're implementing that feedback into our distribution list. We have a member from Denver Public Schools on our external health equity committee, and I always ask her, how do you reach out to your communities, to your schools, to your families of color, to your Title I schools, and what's the best way to, whenever she tries to do outreach and promotion and just disseminating information in general, what's her best practice to reach out to these families, right? So we can take that information and leverage it to our health communication literacy work as well. So it's a really back and forth partnership and just garnering as much expertise as possible from our external stakeholder groups. Final slide, please. Yeah. This is just a visual. One of our co-workers, Nancy, I'll give her the credit. She created this particular visual. We got some feedback from our external task force, and I showed the theming slide before, and they said, well, those themes look very much siloed. How do we make this work as emergent themes, and how does it connect to everything, right? And so this is just a thought that we just wanted to make sure recognize that all these particular themes or focus areas impact each other. And so they do it through SDOH work, they inform us through data, and we want to make sure that they're not alone, and we're not doing something that's not impacting another particular theme or focus area, that we need to consider all of them when we're doing any type of work moving forward into 2021. So that's our recent work. It's ongoing. I think some of the next steps is figuring out who needs to be part of this discussion moving forward, and what does this discussion look like, and what does the table look like, who's missing at the table, and what type of table are we going to create. What we heard from our partners, maybe a committee isn't the best way to do this work into 2021. Maybe we do some type of networking for each theme, and we identify who the specific players need to be for a particular area. So again, it hasn't been baked out completely, but we're working internally to figure out how these connections work with Colorado Access, and then we're also wanting to get feedback from our new iteration of external stakeholder groups in terms of how do we move forward. So that's where we're at now, and we're looking forward to building this out further as this goes on. Any other questions, thoughts?
Thanks.
Hi, Rene. This is
Perfect.
Rich.
Hi, Rich.
It's good to see you again, Rene. Rene and I have worked on at least one project before, and I still think it's ongoing, Rene, by the way, but more later on that. But, you know, Rene, a couple of years ago, Social Determinants of Health Group had one of its meetings, and it was at the People's Building, and it was really on this topic of diversity, equity, inclusion, the struggles and issues. And that's when we had Caitlin Wolf and Vanessa Owen, I think, helped lead that. And we had lots of people attending, and everyone shook their head, yeah, we've got to work on that. And even though we really tried to get something going, we kind of left with, yeah, we got to work on that. And now we have this, and I'm really happy to see that this, and it has some roots, and it has a good foundation, and it talks about so many areas. So I really hope that this really does take traction and does get going. What can we do to motivate that, Rene? What do you think? This is a tough area for many people. At that time, a couple of years ago, it pointed to Children's Hospital as an example of where maybe it's not working very well. So many people are people of color who are coming in, and who are they being greeted by? Well, all white people. That was just one example of the struggles that in that time in which everyone realized we had to work on it. And that was a couple of years ago. So here we are again, and you've had 6 months, 5 months of work on it. Any ideas on how to really motivate traction in this area beyond what we've done so far, what you and your group have done so far, Rene?
Yeah, Rich, that's a great question. What I would like is providing a list of, I can share each theme with the group as well, or the slides, however you all want to see it. And it would be great to get your thoughts on whichever focus area or theme that you would be able to provide some thought in terms of what we can be doing at Colorado Access, and identifying who would be a good organization to partner with for that particular theme or focus area. I think that's a really good next step. Obviously, as I mentioned before, this group isn't all inclusive. And I think there's some things that we can affect and some things that we can't. But say we do have, like you mentioned, Rich, maybe there needs to be an emphasis around the hiring of more people of color at our hospital systems. And if there's an opportunity to apply for a community innovation pool program, I want to make sure that we promote the community innovation program to that particular organization or send it to that particular distribution group, making sure that we're promoting it as much as possible. So I think those Rich would be some great some next steps for me to help. I see, if you look at the themes and you see access to care, Rich, you can send me something. Have you thought about an XYZ organization that has been doing some great work with access to care? Are there any best practices around this space? Who's doing this well? And how can we help support that particular work? So I think those are some ideas that I would welcome in terms of next steps. And then I also want to make sure that you all are aware or updated of the work that we're doing. So one of the things that we're just throwing around, Rich, is I don't want to present today and then just never hear from me again, unless you want to. I understand that as well. But I think one of the thoughts that we had is, let's take one theme and on a quarterly basis, let's update people, communities, on what we're doing on that particular theme, and what can we do next, and what can we do better, right? And so I think that's something that we want to approach, so everybody's updated, and as Rich said, so it doesn't fizzle out, it doesn't die out, or you just don't hear from us again. This is a commitment that we're going to try to do at Colorado Access moving forward, but we also want to make sure that that what we're trying to do is the right thing, or we're just off base and that we're going in the wrong direction. We need that feedback as well from our community partners. And so that's another piece, is to make sure that this information is coming back to you, Rich, and to everyone else in the community that needs to hear this work.
Okay, good.
Rene, for those who don't have it, would you mind putting your email in the chat? So if they do have feedback or input, they could send that your way.
It's a great idea. And then also just to consider something, I don't want to also just throw it out there. We are at Colorado Access. We are a nonprofit health plan, and we can't do everything in terms of this diversity, equity, inclusion, but we can try to do a few things in this space. And so I hope there's some cool ideas that we are going to have in 2021 in terms of funding opportunities for SDOH work and health equity work. So if it's anything, I think I'll promote the program. Our first community innovation pool program, it was our first iteration at trying to lift a kind of a foundation, and we had a lot of lessons learned, and so we are going to try to kind of do a better, just work on some of the things that we could have done better moving into 2021 for supporting our communities and small community organizations that may not have grant writers on their team, but we're going to try to provide free TA around grant writing for this next round of applications, so we can try to level the playing field for those smaller organizations applying for this work as well.
Yeah, thanks for bringing that up, Rene. I actually plan on having a future presenter be one of our community innovation pool recipients, so they can talk about that the program that they're working on with us, and so I think that's a great summary. I had a question. I guess it was along the lines of what Rich was asking. What sort of tangible things do you see coming out of this task force, out of this work, that Colorado Access members or just members of the community could see as a result?
That's a good question, Julia. We are going to try to go after some low-hanging fruit within the themes. I think one of the things that we have to come back with is who needs to be involved internally, and without us, we have to be really careful. When I say we, community engagement, our team, Julia's team, our team, we can't commit a particular department to do something before we ask them and before they understand the big picture. So right now, I think what we're going to do is figure out how or what strategy we need to consider in terms of next steps. I will say that there's a lot of work internally with diversity, equity, inclusion, and that's very much internally focused with Colorado Access and what we're doing internally with the structure and the organizational culture. But we are not quite at the next step stage, Julia, to do programming in this space yet. We will have in March, we will convene another session of this health equity task force with a full-fledged kind of proposal. And it's going to take the next few months to get buy-in internally to build something out. And then I think this is an opportunity to come back with this group to kind of share this idea. I think would be probably the next step that can be accomplished from our work at Colorado Access. I'll share another proverb since I already shared one before. If you want to go fast, you go alone. If you want to go far, you go together, right? And so we're trying to get as many people to buy in to this work as possible, internally and externally. And it's sometimes it's a tough time kind of moving that piece, but I think we have a lot of support in doing this. We just have to make sure that we're all doing it at the same time and we're getting complete buy-in from Access in this work. So that's what I can say on that piece.
I think is a good sign that, after the community campus partnership went away, they set up the Tessa's office that she works in. And so that shows that there is traction. There are things going on. It's a difficult area. So what you're doing at Colorado Access and what's happening at Anschutz campus, I think really kind of go in tandem, work hand in hand. And it's good to see that, because a couple of years ago, it wasn't quite there with any steam or with any energy, but I see that now. So those are good signs.
Yeah, Rich, you brought up a good point. The other piece is who else is doing this work in our community, and where do we fit in this space with DEI work, right? And understanding kind of a meta-analysis of who's doing what in our community around DEI would be extremely helpful. We're just one small system of other systems trying to do this work, right? And so how do we fit in? And that's where Rich comes in, who has a lot of irons in the fire. He knows what's going on in a lot of different places. So if you can help us, again, going back to, this is an organization is doing some cool stuff around access to care, you should consider talking to them. That's stuff that we need to be aware of. And our Tessa, what's going on with you all in this space, and how can we partner as well? Is Regina is the leadership in that team? Tessa, is that?
Yeah, she is our leader, Regina Richards.
Perfect. Well, she's on our task force, and so awesome. It's great to see those connection points, and so we know what we're doing, and we're not doing this in a siloed fashion.
So Regina's also on our board, the Aurora Health Alliance Board of Directors.
Perfect.
Rene, thank you so much. I wanted to just interject in here. You're not alone. Colorado Access is not alone in trying to figure out where your place is with this. The Aurora Health Alliance is doing similar things. adjusting, I mean, even going back to probably adjusting our mission, adopting an equity statement, but we certainly know that the DEI work is not going to live with AHA, but we're trying to figure out how we can support the work that is going on with organizations that are better positioned with better resources. So we are very interested in supporting the work that you are doing. So thank you.
Thank you, everyone, for allowing me to speak around this DEI space. And if anybody wants to take a road trip to Greeley, just let me know.
Thanks, Renee. Were there any other questions before we move on to community announcements? Well, if you have any input from yourself or your organization, please feel free to email my teammate, Renee. Just gonna volunteer him so that we can incorporate your suggestions, maybe even partner with you in this work. So I'll hand it over to Tessa.
Thank you. So now is the time for updates from you all. So anything that's going on, resources to share, ideas, projects you're working on as it relates to social determinants of health. And I can actually, I'll start. It kind of ties into something you mentioned, Renee, on, let's see, Thursday, my office has partnered with a couple community organizations to do a Q&A webinar for community about COVID vaccine, and it's specifically addressing concerns in Black and Brown communities. So I've got a flyer if anyone wants to reach out. There's going to be Spanish interpretation as well as sign language. So I'm going to throw my email in the chat. But if you want either of those flyers, I can send that to you.
Who's registered already? Yeah. Thanks, Tessa.
I'll go ahead and share a little bit. As I mentioned earlier, we do the access to care processing applications for Medicaid and CHIP. And one of the things that is sort of getting out there is there's a lot of people with coverage that are locked in for them to keep up with, submitting updates to their information to cover them when the public health emergency does end. There's an expectation that there's going to be some fallout, and doing the proactive stuff of messaging. If you get a letter asking for information, be sure to send it in. The counties are working those as ongoing. And another thing that I wanted to mention, and this is sort of late breaking, a couple days ago the state came out with an okay to use a verbal consent versus a wet signature on an application. That's been a barrier for the last 9 months because of all the separation and people can't interact. So that just came out on the 6th of January, and it's huge news. It takes away a barrier. The public health emergency now goes through April 21st, and big news. Did you have a question, Mandy?
No, I was just applauding my
Right.
past life, as Deb knows, was in compliance. So I'm just
Yes. So we're pretty excited about it because it does take away a barrier and provides access. Thank you.
Anyone else?
Hey, I just wanted to mention about the, if you've heard of it referred as the SHE, but it's known as the SHIE, which is the State Health Information Exchange. Aurora Health Alliance is partnering, it's one of the partners in developing the SHIE, and the goal of the SHIE is to connect patients and clients with resources that connect with their social determinants of health needs using a centralized system. So in other words, with an individual's consent, participating organizations can access and add to the shared client's profile and make referrals based on what needs are. So in other words, if someone's needing food needs, housing, financial, etc. So, and you know, it really is an effort to link service providing organizations so they can access and share information based on referrals to help clients get really kind of all the help they need that affects their social determinants of health. And Mandy, you can speak to this more, but you know, one of the next steps they're looking at is eventually doing some focus groups that encompass organizations that really do connect their community members and the people they serve to resources. So you've probably heard of it, or you'll get information coming from the SHIE group at some point, maybe asking for your participation in these focus groups, looking at how do you help the people you serve connect with resources? Do you screen for resources? What does that look like for you? So it's something, you know, pretty exciting, and it's a big undertaking, but it really is a way to hopefully increase the health of the community by really looking at all of the things that affect someone's health, not just medical. Yeah, Mandy, did I forget anything?
Yeah, so the focus groups will be either an actual group or just a brief one-on-one interview. They want to know how those referrals happen and what the barriers are, so that in the formation of this system over the next year or so, what they can be addressing. And it will be bi-directional, healthcare to social services to healthcare also. And the coolest thing, I think, is that there will be follow-up with those referrals, and all those referrals will be tracked, so people aren't lost in the system once they're referred. But Joe and I have been spending time at these meetings going, what? It's taken a long time. So as soon as there's more information to be shared, we'll share it in the AHA newsletter and with you all for sure.
Well, I'm working kind of an interesting little project on the side in my spare time. We all know access to care is certainly a DEI issue. It's bad when it comes to specialty care, and it's even a problem when it comes to primary care, especially if you're undocumented, because of a couple of reasons. One is it does cost. In most cases, even if you're going to a federally qualified clinic, you know, $30 maybe is, but it doesn't seem a lot to us, but for many, especially now, it's a lot. And also fear, the fear that when you're collecting data on people, which you have to do as an FQ, for instance, federally qualified clinic, that it scares people, especially in the climate, hopefully, that we're transitioning from, but it will be for a while. So I'm working with Catholic Charities right now on maybe supplementing the current within Aurora process for undocumented folks to get free care. It's something we've been thinking about. We just had a meeting with Stride, actually, with our fellow board member, Susan Todd, about this. And it's something that is an interest to Stride, and I think others, including Dawn, which is doing it, but it's only doing it one night a week through telehealth. So if this does get going with the support of Catholic Charities, which really is interested in it, we're looking maybe of setting up a one-day a week clinic up at the Marisol Clinic, which is just off of Central Park, which is the old Stapleton. Right now, it's a clinic that works prenatal care, postnatal care, prenatal care, working with the Bella Health Family Health, but with some volunteer doctors, part of the Catholic Medical Association out of Denver, and see if we can get something like that going. It would be based on a model that already exists up in Minnesota, which we have some expertise on down here in this area due to the doctor who created it. So I just wanted to say that, you know, when we're talking about diversity, equity, and inclusion, access to care is big. And for the undocumented people, it's big when it comes to primary care. So it's just a little thing that maybe can be done if this gets off the ground, working with health providers in the area to kind of address this issue that we all know exists. That's my update.
Rich, can we just call you an octopus? You have like your tentacles in everything. Love it.
You're just saving Aurora. I've heard it a few times. All right, anybody else have any announcements that they would like to share?
Well, this is Lisa again. I was interested as I enter into this work here to learn about the SHE program. Just as I am learning about my new role and how things work in Colorado. I moved here about 2 years ago, almost, but I feel like once we started to get settled and the pandemic hit, and then I didn't get to see anybody anymore in person. But as I enter my new role, one of the things that Children's Hospital has some funding for is to support community health navigators and to disseminate the model we're using at community practices. And so that will be part of something that I'm doing. And so how that interfaces with some of the state programs and other programs coming up will be interesting to see. And so I'm glad I learned a little bit about that today, because it may be a good time for that program to be up and running and to be able to connect as we figure out how to do that, connect that to some of the reporting mechanisms.
Anyone else? Okay. I don't think so.
Well, thanks everybody for joining. I feel really honored that you all came and spent your time with us today. Spread the word about future Aurora Health Alliance meetings and SDOH meetings. We hope to see you all here again for the next one. And Joe, I'm terrible at this. Do you know the date of the next SDOH meeting?
I think it's May 11th.
Okay, perfect. Thanks, Joe. Always coming to the rescue. Well, thanks everybody. We hope you have a great afternoon, and we'll see you at the next meeting.